Welcome to Beyond the Wheeze, the podcast where perseverance meets potential. I'm Josh Realm, public speaker, marathon runner, asthma advocate, and your host as we explore the intersection of health, fitness, and resilience. Whether you're managing asthma, chasing a new personal best, or simply looking for inspiration, Beyond the Wheeze is here to show you that no challenge is too great to overcome. Together, we'll uncover stories, insights, and strategies to help you push beyond your limits. It's time to breathe deeply, move forward, and unlock your true potential, one step at a time. Welcome to Beyond the Wheeze. I'm your host, Josh Realm. Today's episode is special as it marks the end of Season 1, and what a season it's been. In over 24 episodes, we've shared stories from people living with asthma, COPD, and lung cancer, and from those working every day to create change. We've heard from advocates, innovators, clinicians, and changemakers who are reshaping the future of lung health. This episode brings together some of the most powerful, insightful, and inspiring moments from across the season. These clips reflect the heart of what the show is all about: real stories, meaningful conversations, and the power of collective voices. Season 2 kicks off on October 28th, but before we look ahead, let's take a moment to look back. In our first clip, Grace Pyatt, asthma patient advocate and professional Canadian volleyball player, shares whether her asthma ever held her back from the sport she loves. Did your diagnosis or even, this story here, did anything like that deter you from playing volleyball?
Yeah, I think so, and it's sad because I remember when I first started my fundraiser for Asthma Canada, I remember one of the reasons was because I, one, almost retired myself, like, even before university was over, and something like that game, was a major moment, kinda like, "Why am I doing this to myself?" But also, I had a lot of guilt, I feel like, put on me by some physicians that were involved at the time because they became nervous. Obviously, I understand why.
Mm-hmm.
Um, and they had kind of felt it was dangerous for me to be playing, but then also like unfair for staff to have to respond to emergencies and stuff all the time. And I remember one doctor kind of, which I don't agree with, but almost threatening me with medical retirement, saying like if I had one more asthma incident in this year, like I was done and I was not going to be playing anymore. Which I don't really feel was the best way to handle it because obviously then I had all this added stress, which isn't good for your asthma either. In like I can't have another asthma attack. And then I honestly I feel like I withdrew because it was like I can't tell people I'm struggling. I can't tell people that my asthma's not good today because if I admit to that, I might be benched, and
Yeah.
it became that. So then I formed this whole embarrassment of my inhalers. I remember like I would take them behind the bench. I would like bend down like behind the bench or like go into a stall in the bathroom before the game, take them in there.
Mm-hmm.
And I mean, now at the point in my life where I don't feel that embarrassment, it's kind of crazy to me. But at the time, I do understand why I felt that way.
In this clip, Scott Bailey gives us a glimpse into what daily life looks like for him living with COPD. What does a typical day look like for you in terms of managing your COPD?
First thing I do is I wake up. When I wake up, I grab my one inhaler and I take a couple of shots and relax for another minute, couple minutes in bed. And then I get up, come downstairs, try and drink a bottle of water and have some coffee and read my internet and my messages and stuff. And then proceed to go upstairs and get dressed and shower or whatever, and then start trying to plan the day, which I have to plan the days in advance. You just don't get up and throw your shoes on and out the door you go. I can't do that. I put my shoes on, go, and then I have to sit in the car for a while to catch my breath again. It's not the most fun thing to do, but that's how you have to do things. So you get used to it in a way. My wife does a ton of stuff for me, but if something's upstairs, I say, "Oh, Jesus, upstairs." Well, I'll go get it. Instead of me running upstairs. Like today, she was outside shoveling the driveway. Stuff that I used to be able to do, and I can't do that anymore. So it's very frustrating to me for that. I was a very athletic person all my life. And for that to be taken away is pretty tough, pretty tough.
We spoke about that a couple of weeks ago, right? That feeling of your wife having to do the driveway, for example, to shovel the driveway while you're sitting there watching. As a man, I can tell you it impacts you for sure. It's not something you want to see. And that's, something else that goes hand in hand with those illnesses such as this is, well, it also takes a mental toll, an emotional toll.
Absolutely. Mental and big time. There's a big issue with that too. And you get to a point, you go, Jesus, I don't know if I can deal with this much longer,
Mm-hmm.
And you think about, then you think about your kids and everything else, and you go, yeah, I can deal with it in here. So that's kind of cool.
In this clip, Jeff Beach, CEO of Asthma Canada, shares what he sees as the biggest challenges facing asthma patients in Canada today. From your perspective, Jeff, what are the biggest challenges asthma patients face today in Canada?
Well, I think, asthma is obviously a very prevalent disease. There are over 4.6 million people who across the country who have been diagnosed with asthma. There probably are more asthma patients that are living with this disease, that especially milder forms of asthma, who may not even be diagnosed. That number is probably larger than what it is, what we're reporting rather. But the biggest challenges are around access to proper diagnosis and healthcare resources, and sometimes medication as well. We're very fortunate to live in a time where there are incredible medications available to people living with asthma and other inflammatory diseases, like biologic medications that for people with severe asthma that was considered to be basically untreatable or very, very difficult to treat. They're seeing medications that are available today making a huge impact on their lives, life-changing impacts. But it comes down to the biggest challenges would be the fact that a lot of people with asthma are not diagnosed properly. They're not given the proper education in terms of how to manage their disease, because medication is only one part. As anyone that knows your story will attest to. Sure, yes, you do use your medication and rely on that, but you've also done a lot around your life around avoiding triggers and improving your lung health in general. That's made a big difference. So the biggest challenges are, helping people understand that. And asthma tends to be a disease that kind of gets lost sometimes in that process. And we want to make sure that we make noise around it so that that doesn't happen, so that people know what's available to them and how they can manage their condition.
In our next clip, Katie Hewlin, a lung cancer patient advocate, opens up about the moment she was diagnosed with stage 4 lung cancer and how she began to navigate that reality. To start, I'd love for you to take us back to the moment when you first received your diagnosis. Can you share with us that experience and also how it shaped your journey from that point onward?
Yeah, so it's almost 4 years to the week right now, actually. So 4 years ago, I was working remotely from home. It was 2021, and we were not quite a full year into COVID hitting Canada and being in lockdowns. And I was still trying to figure out why I had this really abrupt and invasive cough, really invasive in terms of like my day to day. I was constantly coughing. Working remote, I was constantly putting myself on mute, coughing, and then trying to get a few more words out, putting myself back on mute. And it had been about, close to 6 months of me dealing with a cough, but I would say about almost 5 months of me working with my GP, my doctor at the time. And we went through so many different avenues to try to figure this out. What could be the cause of it? And I just remember getting a call. It was a Tuesday. I was about to go into 11 a.m. meeting, and my doctor just said, the mass that we found in your lung last week, when we compared that to your blood work, it's highly concerning. You need to rush yourself to emergency. And to me, I was just so nervous. I wasn't expecting a call like that. I packed up everything that I thought I might need and didn't even know what that would be. And my husband dropped me off at the hospital. He wasn't able to come in with me because it was COVID.
Sure.
And I just remember going to this emergency room and, they're asking me, do you have a cough? And all these things that sounded like COVID. And I said, I do, which is why I'm here. But trust me, it's not COVID. I do need to see a doctor. And My doctor actually thought it was a blood clot. He thought I had the mass that they detected in an x-ray the week before. It was a blood clot. And so I just sat and waited and finally got into a room, in and out of scans. I was hooked up and just spent about 6 hours at the hospital. And at the end of that 6 hours, the emergency doctor at the time came in and just said, it seems to be that you have cancer. It's in the lung. Seems like you might have a lesion or two on your liver. When we did a scan, you need to come back tomorrow and we need to figure out how far this has spread. And it just completely took me off my feet. I just wasn't expecting to go in to the emergency department that day and leave with a cancer diagnosis. And at the time I was 33.
Not to mention without your husband, COVID was tough as it was. You're going in there, you're finding out that diagnosis and you're alone. That's challenging.
It was extremely hard. I didn't know how to take it. And I even had, when I messaged my husband, or I guess I could probably call him to say, I'm ready to be picked up. I'll tell you everything once we get home. And I remember being in the car ride, and it's a short car ride, but I didn't want to tell him as he's driving that I have cancer. And so I just said, you know what, I have to go in for more tests tomorrow. And I came up with something. I don't even remember what it was. And then as soon as we got home and situated on the couch, that's when I said, okay, this is actually what happened. And yeah, to go through that alone was a lot.
In this clip, Maggie McNeil, Olympic gold medalist swimmer with asthma, reflects on what it felt like to stand atop the podium and know that she had made history. Her story captures the pride, emotion, and triumph of reaching a lifelong goal despite challenges. You've been named the best female athlete of the Tokyo Olympics and have set multiple world records. What did it feel like standing on top of the Olympic podium, realizing you had made history?
Weird. I think with the whole COVID time and the COVID Olympics, it was an interesting experience. And honestly, it feels pretty similar to a world championships or any kind of world-class meet in swimming. And I think the only difference is that the word Olympic is tacked on to the front of it. And that, I think, more people tune in to watch. My family and friends couldn't be there. So it really was a unique experience. But as for the competition, everyone is the same kind of throughout my career, which is nice. And as you swim longer and you know more people, it's definitely more comforting to see familiar faces when you're about to compete at the Olympic Games. But that, I think, is just something I wish that I could have shared with my family. And that's just the time that we were in. But I was lucky that one of my cousins actually set up a video camera on like the balcony of the cottage where my whole family was watching it. So I have a video of it, which is the next best thing.
In this clip, DIA Labs Canada's CEO and Chief Scientific Officer discuss the integration of AI into respiratory health. They share how AI-driven insights are helping improve asthma management and support better outcomes for patients. The integration of AI into respiratory health monitoring is exciting. Can you share, Pavan, how AI-driven insights are helping improve asthma management?
Sure. Something that we've mentioned before, Josh, is how asthma, again, is very individualized, and being able to track that over time and understand patterns that we may not be able to perceive ourselves, that's very valuable. That's very valuable. And unless, you live with a physician, or, you have them in your house, how are they going to be able to tell what's happening every single day, and recognize those patterns for you? You're coming in when things get bad, right? But that's not where asthma, grows and changes. It's over time constantly, right? So having software that's ready, that's equipped to be able to track these changes that are very subtle, understand the patterns over time, that's very valuable. And that's where AI really alleviates the burden for practitioners to be able to summarize a lot of this data and present even the raw data if physicians would like to see, right? What is it, before anything can be summarized. And, it really does come down to alleviating that burden. The patients that can say, okay, maybe I should just take my medication. I don't have to go to the ER. I don't have to go, to the office just yet. There are a few things I can try differently, and then we'll see when it gets to that road.
In our next clip, Mia Fritsch Anderson, advocate, content creator, dancer, athlete, and former Miss Illinois Teen 2022, shares what first inspired her to start creating content about asthma and lung health. She reflects on how her passion for education and advocacy turned into a
Let's start from the beginning. What first inspired you to start creating content about asthma and lung health?
Well, in 2020, I was sitting in my house doing nothing because of the pandemic, and I had a really big realization that I noticed a lot of the negative stigma of asthma in the media. It's in one of my favorite shows, Bob's Burgers. They use it as kind of a comedy bit, and that's not what asthma actually is. So I started looking for people who are talking about this type of thing, and I couldn't find anything, and I decided to start doing it by myself. I started producing content on my social media at around 200 followers, and I actually took a social media course through MIT online to learn about the algorithm and how I could reach more people, like using fun trending audios, colorful backgrounds, keeping videos short so that I could reach my audience, because all teens are on social media, and especially during the pandemic, they were. So during the pandemic, I started creating that content and building my platform, and it's really just turned into something that I could never have imagined when I started.
In this clip, Dr. Mika Nonoyama, leading researcher, clinician, and respiratory therapist, shares one of the most rewarding aspects of her work in respiratory health.
What's one of the most rewarding aspects of your work?
I would say, sort of we're going to have a common theme throughout our conversation, but definitely collaborating with and learning from the individuals with the lived experience, the clinicians, and everyone involved in the practice to research to practice process. It's always sort of a cyclical process. I'm always amazed at the level of innovation in respiratory research, despite the lack of funding opportunities out there.
Mm-hmm.
Like respiratory and lung health research is really underfunded given the amount of people who have chronic lung disease, not just asthma. I mean, never mind just asthma, but it compared to other chronic diseases, which are important, but is very underfunded. So we get very creative with that limited funds. I've been lucky to work with amazing people who are willing to go outside their comfort zones to contribute. And that kind of motivates me. And in a way, I wish I had 3 of myself so I could work with everybody. But the good news is, when you sort of encounter a wall or delays or something, I know I'm in good company, both from an empathetic sounding board kind of thing, and also for providing sort of actionable solutions as well. That kind of helps as well.
In this clip, Stetson Childress, a collegiate runner, coach, and asthmatic athlete, shares how he managed his asthma through his running career. He discusses the strategies that had helped him perform at a high level while showing that asthma doesn't have to be a barrier to success.
So I'd like to talk a little bit about managing asthma as an athlete. Many might view asthma as a barrier to high-level athletic performance. How have you managed your condition throughout your running career, and what strategies have you found effective?
So a lot of people don't know this, but when I started running in 4th grade, that was my first introduction to running, even though I'm still trying for basketball. And I actually had a couple asthma attacks while I practiced, and I couldn't finish. People had to get the coach, and I had to just leave practice because I couldn't perform, couldn't breathe. Allergic to everything under the sun. I'm allergic to trees, grass, pollen, etc. Like anything you name. And even when I was playing basketball in the hot summers of Kentucky, I couldn't play a lot of times because of moisture in the air, something like that, or the humidity. And it was just very, very, very difficult for me to perform in any sort of athletic. And then I got older, and it was when I hit about 8th grade, 9th grade, and I failed the basketball team, 8th grade, failed again, 9th grade. I was like, okay, I'm going to get in control of my life, and I'm going to start making a change. And whenever I'd have asthma attacks, I'd be like, okay, I need to find a way to control this. And then that's when I'd start breathing in more cold air, just relaxing, taking my inhaler as needed, taking over-the-counter medications for allergies like Claritin, etc. But the one thing I realized was if I can just keep going, I don't have to be a world beater by any means, But if I can just keep putting one foot in front of the other, even on an easy run, I'm getting stronger, which I'm sure you can relate to.
Mm-hmm.
And it just clicked one day. Like if I can just keep putting one foot in front of the other, because no matter what, you can always take a step forward.
Yeah.
Like your mind may get clouded, like, oh, I got another mile. Oh, I got another 800 meters in this race. But at the end of the day, you can always take one more step. And it dawned on me. So from that point forward, freshman year, after not making the basketball team, I was like, I'm going to take a lot of steps forward, and I'm going to try to be the best human being I can possibly be in the sport, outside the sport, whatever my God wants me to do as a vessel of his on this planet.
In this clip, I'm asked by Joelle Lachance Artendale about common misconceptions people have regarding asthma and exercise.
What do you think are some misconceptions that people have about asthma and exercise?
Yeah, so I think I have two. The biggest one is that people with asthma shouldn't exercise. I was one of those people, and I was one of those people because I was told for years that that's something I shouldn't do. Now, many assume that physical activity will only trigger symptoms, but in reality, even as somebody with exercise-induced asthma, when managed properly, it can improve lung function and overall health. Now, another misconception is that inhalers are a sign of weakness. And I don't feel that so much today. Of course, I don't feel that at all today because I advocate for it, right? So I'm proud to hold my puffer out. But when I was a kid, it was a lot different. I was that kid in the gym class who had an inhaler in my pocket or had, to give my teacher that inhaler and have to use it all the time or have to sit down and use it, go to the locker room because I was embarrassed to take it in front of people. That was challenging. So do not ever think that somebody with asthma has any sort of weakness. Asthma isn't a stop sign. It's just an obstacle that can be worked through. We just have one extra obstacle than you do.
In this clip, Adrienne Lamb, asthma advocate, runner, and researcher, reflects on key findings from Asthma Canada's 2024 National Asthma Survey. She shares what stood out most to her and how these statistics reveal ongoing gaps in asthma care across Canada.
Let's talk a little bit now about your work with Asthma Canada. We've been talking so much about them. You contributed to their 2024 National Asthma Survey, which I read, and it was great. It really revealed some eye-opening stats. Just to dive into a few, 66% of Canadians with asthma report financial strain due to care costs. 26% visited the ER in the past year. 98% say wildfire smoke and poor air quality make symptoms worse. Absolutely, that's probably the worst for me. And 92% report stress related to asthma. And I feel stress related to asthma all the time. What struck you the most from this data, and how do you think it reflects the gaps in asthma care today?
Yeah, I'm really grateful for the opportunity to have contributed to that survey analysis and report. But what struck me the most, I think, was just how many people, 66% you said, reported financial strain due to asthma. Yeah. And I think that's truly heartbreaking, but also not surprising. So I've spoken to people who've had to ration their inhalers or skip follow-up appointments or, they couldn't afford certain things. And that just shows you how access to care is super important. It's not just about having a health card. It's about whether, someone can take time off of work or afford medication. Yeah. And I was also really, something that also really hit me was the 92% that said they reported stress to asthma. So I've been there, worrying about, my breathing during a run or trying not to cough in class so people don't stare. I just, I know that asthma isn't physical. It's also emotional too. And it affects your confidence, your social life, your ability to say yes to things. And something new this year was also the environmental stats. So, almost everyone said the wildfire smoke made their symptoms worse. And I just remember 2 years ago when the wildfires in BC were happening, I was worried about even taking a walk outside. I was constantly monitoring the air quality. So, even something as simple as walking outside can be really frightening for someone with asthma. So when you look at all this data and you kind of just see this system that isn't really built to support people with chronic conditions like asthma in a holistic way, I just think better education, yes, would help, but also just better coverage, mental health support, and policy solutions that would address other factors such as environmental ones, better access to care in rural areas, CRE. Yeah, I think there's a lot that can be done.
In our next clip, Jessica Buckley, President and CEO of Lung Health Foundation, breaks down what she calls Big Tobacco 2.0, the rise of vaping among young people following the historic Big Tobacco settlement. She explains the implications for lung health in Canada and why addressing this issue is critical for a smoke-free future.
So let's move on now to tobacco, vaping, and the fight for a smoke-free generation. You've been a strong voice when it comes to the risks of youth vaping and the tactics of big tobacco. We're seeing a surge in vaping among young people.
Yes.
You've referred to this moment as Big Tobacco 2.0. Can you unpack that a little bit? And what are the implications of the settlement? And what are we facing now?
So a few things. Number one, vaping rates are on the rise amongst kids. So unfortunately, Canada has some of the highest youth vaping rates in the world. So this study tracked children between the ages of 15 and we're calling youth all the way up to age 29. But we know that there are many kids that are vaping in middle school and even younger. And the reality of it is that it's creating a nicotine addiction, nicotine dependency. And most kids that start vaping don't even know that they're vaping nicotine and that it's an addictive substance. They're really just interested in these enticing flavors, like mango and raspberry and, blue thunder. So it's really, it's a challenging situation. And the access to these vapes is unfortunately everywhere. We've really got a potential lung health crisis of the future on our hands with that next generation. That is a massive concern for our organization. And we're really talking about nicotine cessation and also a nicotine-free generation because, excuse me, we know that kids who vape are 3.6 times more likely to start smoking cigarettes in the future. So also very concerning. And even being addicted to nicotine through the vapes, we don't have years and years of studies about vaping yet, but we know that teen-year-olds' lungs are not going to be improved by vaping multiple times per day. I mean, and there are lots of cases of lung-related injuries from vaping. Of course, the long-term effects of vaping are still being researched. It's really only been around for approximately 10 years. But look at what we thought about tobacco 50, 60 years ago as well, right? So what we've been advocating for, and you mentioned it, Josh, is something called a smoke-free generation or a nicotine-free generation. And that is a concept that has been successfully implemented in other parts of the world. It's still something that's gaining, I will say, it needs bold, brave government to be able to think of a policy like this. But the idea is that it wouldn't take any rights away from people who are currently vaping and smoking legally over the age of 19 in Ontario. But it would take any children that are born after a certain year, and they would never legally be able to access nicotine products, specifically vapes and other nicotine products that may pop on the market, because that's what we're finding is that the delivery of nicotine is just being added to the marketplace in other ways. So the nicotine-free generation, let's say the example was any children that were born after 2015, when they were about to turn 19, the legal age would then go to 20, and it would go up every year after that. So we've been speaking to the federal government about it. We've been speaking to provincial government about it. And we formed an advocacy group from lung health organizations from across Canada who are like-minded organizations, both national and provincial. And we call ourselves the National Lung Health Alliance. And that group has been doing a lot of advocating of elected officials.
In this clip, Liz Radinovich, a personal trainer, health coach, and asthma athlete, shares the turning point that finally helped her get her asthma under control.
So I know you've gone through some major changes in your asthma treatment plan. What was the turning point that helped you finally get your asthma under control? And how did that shift allow you to return to running?
Yes. Okay. So the big year of flare-ups is what got me to this point, having a very scary incident in the hospital. So 2022 in December was my 8th flare-up in 14 months. And it was just a constant cycle of corticosteroids and then immunosuppression, right? So just constantly. And I've had a pretty, I don't want to say a good system, but it was a system that worked for the time being, where I would have a burst or a little bit longer and then on to the next flare up, right? So that was just kind of the way I was skating above the water or just below the water, whatever you want to call it. And then I also got really good at comparing my situation to other people that were going through worse things. Like, oh, it's not that bad. Like we were just talking about the desensitization of the whole situation. So I had a friend that had a strange or rare tumor in her spinal cord, and she became paralyzed from the waist down. And this was right around the time when I'd been on prednisone for maybe 3 or 4 weeks at this point, high doses, not like a little burst. This was high doses for weeks, and it was not working. So I remember there was a meal train for her, and I was standing in line at the grocery store. It was right before the holidays, big snowstorm coming. I'm feeling like absolute crap. And then I'm standing there and thinking, wait a minute, I need my own meal train. I'm in this situation where I should be doing this, standing on my feet around all these people. And too, when you're just irritable because you're on corticosteroids and it's just everything is coming to a head. And that was my point of realization. We're like, this is not right. I need help. And unfortunately, my primary care was not able to help me. I kept reaching out and they said, oh, do you have a fever? No, I don't have a fever because the prednisone that I've been taking for weeks is suppressing it. And I was taking the nebulizer every 4 hours just to stay afloat. I wanted antibiotics. I knew I had a bacterial infection. Do you know that shift where you just feel your energy drain and you're not hungry? And it's just, that it's progressed, right? So I was there for a while and finally reached out to my specialist after going to a clinic at the grocery store to have somebody actually listen to my lungs and say, okay, you have pneumonia, you need antibiotics. But those antibiotics didn't work. So that was okay, I just need antibiotics and I'll be fine. They didn't work. That's when I'm like, all right, time to pull out the big guns, go back to my specialist. My allergist was unfortunately somebody who I only reserved for situations where things got really bad, where I got pneumonia and I felt like I couldn't get myself out with the typical course that I would do. So finally went back to him, and he's this brilliant 75-year-old doctor. He's not allowed to retire because he just does things the old school way. And they just don't make him like that anymore. Reminds me of my dad and my grandfather, right? So takes notes, right? And his little notebook doesn't, do the medical records. He has someone do that for him. So finally went back to him, walked into the office, and he's like, why are you this bad? Like he was legit mad that I had gotten to that point and was like that for so long. He's like, haven't you been seeing a doctor? Yes, I have. Right. But unfortunately, when you have a clear chest x-ray initially, that's almost like, okay, you're good. But they didn't have me back for one. So he said, you need to go to the hospital first. You need to get some IV steroids just to really get to the source and some more imaging to see what's going on. And then when you come back after we get you through this, we're going to talk about some solutions that are going to make you so much better. And he's like, why has nobody told you about these therapies that can help prevent these types of flare-ups? And I'm like, I don't know. Even having a medical family, right? I should have all the resources. I consider myself a resourceful person. So it's just like I was also flabbergasted. Why do I not know about therapies that can help prevent this? Ended up going to the ER, and I had him call ahead because I was so worried that I wouldn't be treated when I got there because of how the last month had gone with, just constantly reaching out to healthcare providers. It's not like I was complacent and just letting things get bad. I was looking for help and did not get the help. So I get to the hospital. He's like, they are not sending you home. I promise you. I'm going to call. I'm going to talk to the doctor. But the wait in the ER was absolutely ridiculous. I saw a man bleeding and it was going through a rag, and he sat there and ended up leaving and going elsewhere because that's how packed it was. my blood oxygen saturation. So I didn't bring an inhaler with me. I took the nebulizer before I left. I was there 4.5 hours, which, like that 4-hour mark, right, is when, if you're that bad, you gotta have something on hand.
Mm-hmm.
And I kept going over to the station to get my blood oxygen saturation, and it kept dropping. And I think 92 is the level where they consider an emergency. And I was just hovering around 93. And the guy over there's like, oh, that's good. I'm like, it's not good. Not at all when you're used to being like 99, 100, right, on a regular day. So I was just waiting basically to be in a medical emergency and get back. Finally, I got back. They had already done blood work. So they were taking blood work before you got back to a room in the ER, fortunately in triage. And then all of a sudden, a bunch of doctors rush in and they say, hey, we need to get you back for a CT and rule out a pulmonary embolism because your inflammation factors are so high, one called a D-dimer. So I was kind of belligerent then. And I'm like, listen, I didn't come for that. I just came to get some IVs and get out of here. That's what I told my kids. I had my husband take my son to basketball practice, business as usual, right? The show must go on. Just, again, downplaying my situation. So I got a little upset with them. Like, no, I didn't come for a pulmonary embolism. I came for, treating my asthma and getting through this. And they're like, well, we have to do this, right? We have to take you back and get a CT, which in hindsight was a really great diagnostic scan because they could see I also had RSV. So they could see RSV almost like an infant's lungs, right? That's how bad it got with the inflammation and also aspiration pneumonia. So I had a lot going on, but it was good to know so I could finally get treated, get on the right antibiotic. And they said typically they would have admitted me, but the hospital was full. So I would have just been sitting in the ER overnight. They said, we're in touch with your doctor and he's going to check on you in the morning. If things aren't better, you're coming right back. So he promised us that he would check on you and make sure everything's going in the right direction. So I was fortunate to go home and rest in my own bed and not just sit in the ER. And then my husband also had a real talk with me at that time because I had been downplaying the situation so long. He's like, like this, you have to be here. You have to take care of this. You cannot let it get to this point, right? So that was kind of the turning point where I realized, like, yes, I could have died from this, right? It could have gotten to a point where, and it's really hard to realize that in the moment when things get that bad. So that was kind of my turnaround point. Got through the flare-up, got back to my doctor. We talked through some options for biologic medication. And then that was, I think it was January 20th, 2023. That's when I'm always going to remember that date because I was like, okay, I'm hopeful. This has to work. Things have to get better. And they did. After figuring out which one would work best for me, started it and hadn't looked back.
In this clip, Dr. Alan Kaplan, family physician and respiratory medicine expert, discusses the role of pre-exercise medication in asthma management.
In your experience, Dr. Kaplan, what's the role of pre-exercise medication like SABAs or short-acting beta agonists in managing asthma? And how often should people with asthma rely on the rescue inhaler before exercising?
It's a really good question, and it happens all the time. People use them, and I think actually people count on them more than they probably should. And overall, I've said it before, I'll say it again, get your asthma in control because maybe you don't need to use anything if your asthma is in control and you do a proper warm-up. But after that, then we have some choices. So for most exercise-induced asthma, the recommendation is using a bronchodilator prior to exercise, and that's said that 15 to 30 minutes prior to exercise. That can be a short-acting beta agonist. Colloquial names for that are things like Ventolin. GINA, the global initiative, actually suggests ICS formoterol. So an corticosteroids with formoterol combination. And the one that's covered for that indication in Canada is Symbicort. So those are things we can use. And the idea there, by using the ICS formoterol, you're actually getting the anti-inflammatory effect of the ICS along with formoterol, which, while being a short-acting agent, also lasts longer. So that's what most people are going to use, and I think that's fine. I think the formoterol component is nice if you're going to be exercising for a longer part of the day, you're going to be out all day. Formoterol lasts 8 to 12 hours versus Ventolin and so on, which lasts 4 hours or so. For the exercise-induced bronchospasm component, there's other things you can use. You can use a leukotriene receptor antagonist. In Canada, the one we have is called Montelukast Singulair. And again, that would have to be used sort of like the day before and so on. It takes time to be absorbed into your system. You can't just use it a half hour before. You have to think about that, but it can be very effective. Long-acting beta agonists I've mentioned already for that. We used to have medications called chromones, things like Intol and Adocromil or Tylenol, not available anymore. So our choices are fairly limited. We basically have bronchodilators and maybe LTRAs for people who are going to be out skiing for a number of days across a weekend or something like that. So how often can you use it? Well, I think you can use it every single day. I mean, that's fine. You're going to be exercising and you need it every day, then use it every day. And people who use Sabbaths may use it multiple times a day. If you ski and then come out and then go back out again, you may want to use that multiple times a day, and that's fine. There is a but. And the but is that we have good evidence that the overuse of short-acting beta agonists is associated with exacerbations and unfortunately even mortality. We've got to be cautious. So we do include the use of as the number of times we use them overall. So asthma control is considered using it, less than 3 times a week, or less than 3 times a week. So if you're using it every single day for exercise and you have exercise-induced asthma, then really the inflammation is not being managed well enough. Exercise-induced bronchospasm will be a little bit different, of course. If you're using more than 3 canisters a year of SABA, this is not ICS Formoterol, but SABA, short-acting beta agonist, then again, you're at risk based on database trials that have just looked at the numbers used and outcomes. So using it every day is probably fine, but my concern about using a short-acting beta agonist in the absence of using a controller is a very big problem, because we know that short-acting beta agonists actually can sometimes even promote inflammation. One of the theories why the overuse of it can cause problems. So I think it's okay to use it every day, Josh, if you're using an inhaled steroid with it. That's why the ICS Formoterol is such a forgiving strategy to use it prior to exercise. If you're using SABA alone and you're not taking anything else, I think that's worth a conversation with your clinician, because perhaps you're putting yourself at risk by doing that strategy if you're using it so frequently.
In this clip, Dr. Paolo Pianosi, recently retired pediatric pulmonologist, reflects on the legacy he hopes to leave in respiratory medicine. He shares his insight from his decades-long career and impact of his work on patient care, research, and education in pediatric pulmonology.
As someone who has dedicated their life to respiratory medicine, what do you hope your legacy will be in the field?
I just wanted the kids that I saw to grow up to be healthy adults with no limitations, meaning if they wanted to go out, try out for one of the varsity teams, they should not let asthma hold them back. And that was always my philosophy. Even before I could make a firm diagnosis of asthma, I would see an infant and I always thought to myself, this child has the potential to do or become or be anything they want. And it was my responsibility to ensure that their health didn't impede that achieving that goal. And so I always wanted each child that I saw to maximize their genetic God-given potential. And so, yes, I saw a lot of kids with respiratory symptoms, not necessarily respiratory disease. And that's an important distinction, because sometimes even as a respirologist or pulmonologist, you may see a patient because they're short of breath, but in fact, they have a problem in another organ system, or it's really not their lung that's responsible. And so I always tried to tease that out before I just automatically said, well, this is probably asthma, take this puffer and come back in X number of months.
In this next clip, we have the Prince family, which share the heartbreaking events of April 2019 when they lost their 8-year-old son, Rudro, to a severe asthma attack.
Can you walk us through the event of that heartbreaking day in April 2019? What happened and how did it unfold?
Yeah, so April 29, 2018, it was a Sunday. It's one day that we do ritually, religiously, we follow through. Sunday morning, we have breakfast together. In one way that we used to help Rudra drink milk is make his milk as a tea, right? So while I'm having morning tea, he's going to have his tea and Prachi's going to have her tea. Rudra's tea is to be lots of milk, a little bit of color. Tea is lots of milk, less color, right? So that day we had our competition and Rudra finished his tea first. And he was so proud of himself. He was like, hey, I finished. I still remember, it still echoes in my ears. So we had an amazing Sunday morning. I stepped out to pick up my father-in-law. And Rudra was home with Rumi and Prachi. And within 10 minutes, Rumi calls and said that call an ambulance. Rudra's having asthma attack. And this is the first time in my 20-some years in Canada I had to call ambulance. This is the first time it was that serious that we didn't know what to do. I turned back. I came, rushed through. Ambulance was about 17 minutes delayed. Ambulance came, police came. When I came home, Rudra was still wheezing severely, and his face was getting blue and stuff like that. And I remember he's saying, Mommy, I can't breathe. I'm dying. For an 8-year-old to say that, to process that in his head, it was hard. We desperately waited for the ambulance and within that period of the time he stopped breathing. He was unconscious. Ambulance came and they were able to get him back, but he wasn't. They got his heart back, so they got him breathing, but he was not conscious. So they took him to CHIO, and the fight for his life started there. Since that day, he was in ICU for 11 days, and we lost him to that asthma on May 11, 2018. Yeah.
And that's the first thing for me to add is that's probably the first week or first time it happened is we learned about what is classified as uncontrolled asthma. No one ever told us that asthma kills. No one ever told us what an uncontrolled asthma was.
In the aftermath of Rudra's passing, how did you begin to process your grief? And what led you to channel your pain into advocacy?
It was hard. I mean, simply we were broken. First 2 years, Prince and I used to think about going to bed, thinking about killing ourselves, waking up and we wanted to kill ourselves. But then we realized we had our daughter Prachi that we had to live for. I was that mom that I had 2 legs on 2 different boats. I wanted to go to Rudra, but at the same time I knew I had my daughter. But as days passed, we realized that we had to speak up, not just for Rudra, but for every child with asthma and every parents who told me during that time that it's nothing serious. Our grief became our fuel, and we started learning about asthma. We started educating ourselves. We started learning, what wasn't done and what could have been done. We then decided as a family that we wanted to do something for Rudra to keep his legacy going. The 8 years that he lived, I'm sure if he lived for 80, 200 years, he would have created something. He would have done something for the world, and the world would have watched him. So as a parent, we said, we have to do something. And that's when we decided we're going to create the Rudra Prince Hope Foundation to honor our son and to make sure that his story is told and his story gets to people to save other people's life.
Yeah, to keep his legacy alive, right? Rudra was who wanted to help everyone. So this is the way that we keep his legacy alive. This is the way that Prachi carry on Rudra's legacy. And we help other Rudras. And hopefully with Rudra's story, at least we can save one more life. That would be the way that we are honoring him.
In this clip, Dr. Miraj Khan, co-founder and CEO of DigiBiomics, discusses how the healthcare community can balance innovation with patient safety and ethical data use.
When it comes to AI in medicine, data privacy and regulatory hurdles really seem top of mind. How do you see the healthcare community balancing innovation with patient safety and ethical data use, especially in the context of sensitive respiratory health data?
Actually, it starts with ethics by design. I repeat, ethics by design. We embed privacy protections into every layer of development. Whatever development we are doing, each and every layer has a privacy. And that starts from anonymizing data to access control, compliance with regulation like HIPAA and GDPR, and those are essential. And these are essential, and these are the baseline. So we start with all these compliance and integrate in each layer of our development. That's the key. As I started, and we start ethics by design. Our model, our tool, they design based on the ethics. But ethics go beyond compliance sometimes. I mean, not sometimes, most of the times ethics go beyond compliance. It's about consent, control, and context. So we should have a consent, we should have a control, and we should know the context. Patients need to know their data benefits. Most often, patients don't know what kind of diagnosis they are going through. After diagnosis, where their data is. I don't know my X-ray or my ultrasound or my blood report who is using, where that is, and when that is going to be removed or traced. So this is something is need to be taken care, and every patient need to know their data benefits from them, and they should be empowered to say no, so that if the whole ethics and privacy and compliance will be there, so whosoever is using our data for any purpose, patients should have right to say yes or no. And what I see, so if we follow this, integrating all the privacy and ethics in every layers of our deployment and development, and getting the consents and of the patient, if we follow all these rules, then definitely we can win the patients or the subject which are involved in our study, their trust. And that's the way, I think that's the only way innovation earns the trust. If we earn the trust, then definitely our adoption will be much faster and much easier. If you don't trust, if you don't build the trust, or if you don't own the trust from the end user, definitely the adoption will be very, very challenging.
In this next clip, Fareen Wali Muhammad, health informatics professional and co-founder of Empower Speaks, shares her perspective on the role digital health platforms should play in supporting patients with chronic respiratory illnesses.
At Beyond the Wheeze, we often talk about how digital health tools can help manage chronic conditions like asthma. From your perspective, what role should digital health platforms play in supporting patients with chronic respiratory illness?
Yeah, absolutely. And so I think it's about self-management. So when it comes to these various tools, it's to help you manage your symptoms, understand what is happening. And I'll kind of walk through an example. I'll kind of loop back to when I was at ProRes and kind of walk through an example there. Alrighty. So basically, while I was there, we were trying to pilot a platform from Atonics. The platform was called A Touch Away. And the way the platform worked is every day. So it was a platform that was kind of created where every morning, the patients that were part of the pilot, it would ask them, how are you doing? Right. So there'd be a green face, like smiling, doing well, yellow face, not so well, and then red, not doing well at all, need to go to the ER. And so the respiratory therapist would help monitor that. So now when they said that, hey, red ER, okay, call 911, you're good. But sometimes not feeling so good. Why? What's happening? Right. So the respiratory therapist is alerted that, hey, this patient has said they're not feeling too good. And so they would ask them, what's happening? They'd be like, oh, I'm short of breath. I'm bringing up mucus. So that is an indication that, hey, this patient may have COPD or what have you, but it may be an onset of an infection, right? So respiratory therapists cannot prescribe prescriptions, but they can be like, hey, you may want to see your family physician, or if you have a prescription already set at the pharmacy that you can just fill, so you can catch that infection early. Because if you don't catch the infection early, the patient ends up presenting in the ER. When they present in the ER, the chances of them coming back home, especially COPD patients, can be more geriatric patient populations. They're exposed to a lot more. The chances of you coming back home is a lot lower, right? So that's where the self-management piece comes from, where you are, you're teaching the patient like, hey, you're bringing up mucus, you're short of breath. These may be signs that you are developing an infection, right? So if you can catch it and be treated at home with antibiotics, why not? And so I think through the platform, it was a pilot. So basically what would happen is they would do pilot groups, they would provide tablets, pay for the data, all of that, to help patients navigate and understand how to self-monitor. And so those were one of the examples where the respiratory therapist would be alerted on their end, hey, we maybe need to go see this patient today. And so I think that was the idea. That was the beauty of it. And so once that pilot of patients was done, then we'd go to another area and another, because they provided the tablets, they paid for the data, because some individuals are in rural areas where the connection's not the greatest. But the idea was for self-management, right? So to teach you, and I think we even discussed this on my podcast earlier, where education is important. So I think self-management, where patients are learning what's happening with their body, understanding your triggers, what is working, what is not. I'm bringing up mucus. Okay, maybe I have an infection that's coming on. Can I catch that early so I don't have to go back to the hospital? So I'm at home with my loved ones. Maybe I do need to take some care and rest to recover, but there's a greater chance of me recovering than going back home. And so I think even on the clinician side, using AI tools or what have you, like Bluetooth devices to, monitor your oxygen saturation levels. Okay, this patient is dropping. They have a dashboard. Can catch on hey, something's wrong here, as opposed to waiting for it to be, extreme, where you do present in the ER or what have you. And sometimes you do, and you need that care, and that's why the ER is there. But I think it's so important to use these devices. And so when you say about chronic conditions, because it's chronic, right, what that means, it's for a longer term. So you have to learn how to live with it. Now, that doesn't mean, that the whole onus is on you, but for you to be an equal participant, an equal stakeholder in your care. Because a lot of the times it's, okay, my clinician, my physician, my nurse practitioner, my physiotherapist, my respiratory therapist, but you too are part of your circle of care. If you are empowered, you have some knowledge, like, hey, I'm bringing up mucus, something is not right. You can advocate for yourself. You can, help figure out that something's not right in my body. And then having that knowledge, empowering yourself, advocating for yourself allows you to do that. But it all stems from education and having the tools and the knowledge to do that, to identify that. And so I think that's where digital health tools can come into to help patients navigate the space.
In this clip, we have Christine Fader, caregiver advocate, author, and speaker, who reflects on what message she would share if she had just one last breath to influence the world. Her story is a powerful testament to resilience, hope, and the impact of advocacy in the face of personal loss. Whether you are living with a chronic illness, caring for someone who is, or simply part of a community that values hope and resilience, every breath we take is a gift, a reminder of our strength and our ability to keep moving forward. If you had only one last breath, but with it the power to influence the world, what would your message be?
So I'm going to steal from my husband in this moment, because he often said during his cancer illnesses that there's always hope. And he said this to me across the hospital bed one Tuesday late in October, and he was being asked whether he wanted to be taken to a different hospital for treatment if he got an infection. He said, yes, there's always hope. And it was the last time he said that to me, because he died the very next morning. But I hold on to that. He never, ever gave up hope. And it wasn't toxic hope. It was just that he could hold on to the positive things and believe that there was hope for the future. And I think that's really important for everyone.
In this clip, Dr. Teresa To, senior scientist and leading expert in pediatric asthma, explains what early intervention looks like in practical terms for children with asthma. You've emphasized the importance of early identification and personalized treatment. What does early intervention look like in practical terms for kids with asthma?
Yeah, that's the important question. Early intervention is so important when it comes to asthma, and not just to keep symptoms under control, but to protect kids' lungs long-term while they are still developing. The first step, of course, is to getting an accurate diagnosis early using objective tools like spirometry, if and when the child is old enough to do so, and not just going by symptoms. Once a child is diagnosed, we typically start them on inhaled corticosteroids, ICS, as soon as possible. And these help calm the inflammation in the airway and can prevent airway remodeling and lasting damages to the lungs. A big part of early intervention is also having a personalized asthma action plan. And asthma action plan is something that is concrete, that families can follow. It lays out what to do if symptoms get worse and how to adjust medications and when to seek help It gives family a sense of control rather than feeling like asthma is controlling them. We also spent a lot of time identifying and reducing triggers like allergens or irritants. And that might mean using dust mite covers, improving ventilation, or reducing exposure to smoke that we talked about earlier. Families can keep a symptom diary and work with their care team to spot patterns and make changes at home and at school. Medications is another important piece, and understanding how to use them matters. Inhalers need to be used properly, and spacers or breath actuated devices often help kids get the medication deep into their lungs. And we also encourage monitoring over time with tools like peak flow meters, and these may detect symptoms before or problems before symptoms even show up, so families can take action early and avoid emergency visits. Ultimately, early intervention helps kids live normal, active lives, go to school, play sports, sleep well, all without asthma getting in the way. And looking forward, we need to keep improving how we identify high-risk kids and tailor treatments earlier.
In this clip, Dr. Neil Maharaj, respirologist and medical director, shares key guidance for patients and caregivers on advocating for their asthma care.
For patients and caregivers listening today, what should they know about advocating for their care? Are there signs or steps that should prompt them to seek further evaluation or specialist care?
Yeah, Josh, I think it's critical for patients to be your own advocate. I'm sure you've heard this before. Again, you may have heard this in your own lives, that you really need to be your own advocate. And even if it's asking the simple question to your doctor, could this be asthma? Asking that question opens up the door, because then that individual has to address that question, and she or he may address it by saying, yes, it is, and no, it isn't, explaining why. But asking, could this be asthma? Mm-hmm. Can you check that? Is there a breathing test that I still need to do to help with my cough? Is that necessary? Asking those questions, when a patient asks me that, it shows that they're engaged, and it actually makes me kind of reflect, think, what is it about their symptom that I'm maybe not be seeing? So asking those questions, should I have a lung function test? That really helps. It goes a long way. Patient portals are becoming more common too, right? Mm-hmm. So patients can have access to their imaging reports and their blood work, and that allows them to inform themselves and to give them an opportunity to educate themselves. And I think that's a huge benefit. It raises the bar for patients being their own advocate. And so a lot of those aspects, I think, are really, really important. Asking questions. Don't be afraid to ask. Your doctor is there to listen and help to kind of address those questions. If you ask them and they elicit it, that'll go a long way for your care.
In this clip, Glenn Kitchener, COPD patient advocate with the Lung Health Foundation, shares the strategies and daily habits that help him manage his symptoms and improve his quality of life.
COPD is a progressive illness, but you've been able to improve your quality of life. What strategies or daily habits help you manage your symptoms today?
Container of gas to get through the day. And I have to portion out my energy so I don't use up my can of gas before the day is over. It's kind of hard to explain how I can, because of the dyspnea, only have maybe 2 or 3 times where I can get myself very winded, and then I don't come back. I need to lay down on the bed. I need to have a sleep. I'm completely exhausted, and there's nothing left in the well. There's nothing left in the gas tank. So this is something that's really hard to deal with initially. And I've had several instances where I've been home, walked in the door, and just ran over and flopped on the bed and woke up 5 or 6 hours later because I let myself get too far. So this is something I do now. I guess it's not even a conscious thought in my daily life, where I'm going to go, how I'm going to get there. I'm losing my voice here. And all the little things. It's like I said, it goes back to the education where you just can't think like you're a normal, healthy person, because that doesn't apply in your life anymore. So it's just the little strategies. You get up, you put your pants on one leg at a time, and then figure out what you're going to do with the rest of your day.
In our next clip, Dr. Shirley Quach, respiratory therapist, researcher, and clinician scientist, discusses how pharmacological advances like asthma biologics intersect with digital self-management tools for patients and families.
I'd like to move on now to connecting digital health to patient care. Beyond app evaluations, you've studied the impact of interventions like asthma biologics in children. How do these pharmacological advances intersect with digital self-management tools for patients and families?
Yeah, that's a great question. My research in app evaluation, I would say, didn't really overlap with that work that I'm doing for asthma biologics in children. However, that's an interesting question, because I think this goes back to what we were saying in the piece, that there is in a way, the medicinal side of things, like the specific interventions and therapies that is necessary to help with disease management. But then there's another component to it, which is the self-management piece, right? And this is where that digital technology and mobile apps, for me, what I believe is really falls into, right? Because we can give you the medicinal and the pharmacological treatment, but then there are other things, you need to, take charge of as the ones living with that condition, right? So, for example, it's the COPD, right? There's the inhalers that they have to take regularly, but at the same time, some other things to really, be the responsible of the client is to, be motivated to exercise, to ensure healthy eating. These are some of the other things too that is part of that like self-management component. And again, self-management is so important. I couldn't stress it enough, but it's hard for somebody to do self-management if they don't have that education. And I think that's where the digital component can really kind of come in, is that if they need a bit more education and they need that support for education, digital apps and digital interventions might be that solution where, they can, again, choose their own adventure, figure out where they can get that resources to learn more about their disease, especially when you're presenting with an app that is credible and comes from a credible source. I think they can really learn about their disease, why it's important to take the medicinal side of things, but also be mindful why it's important they have to take charge of managing their disease, either through exercising, healthy, in a sense, healthy living, good nutrition, mindfulness, meditation. So some of these things I think are also very important. So there's also non-pharmacological techniques that sometimes may be used in managing chronic conditions. So we talk about like inhalers, but dependent on the type of COPD, because there's the emphysema and the chronic bronchitis. Some individuals produce, for example, a lot of phlegm, right? And there are, again, tools and things that can help individuals clear that phlegm. It's very important that they clear that phlegm. And then these techniques, you have to learn how to use that technique to help clear the phlegm. And so again, this is probably a place where digital technology can facilitate that. And that's through education. Good information and resources can really help empower clients and patients to learn more about the condition, the techniques and non-pharmacological techniques that they can use to help with their self-management. So I think, again, part of this is a big picture, right? It's not just about, making sure you take only the medication or making sure you're eating healthy. It's about all these things, right? It's we are, as humans, there's many parts to us, right? It's a holistic picture that we have to remember. And digital health can sit in somewhere along there to, help facilitate us to understand that holistic picture, and for clients and patients to know that, like, hey, digital health can really help me understand more about my disease, why it's important to, for example, take the medicine that I'm prescribed, and then why I need to ensure that I am, walking
1 kilometer every single day or doing these exercises, aerobic and non-aerobic exercises, like all these things are very important. So I think it really, again, goes back to very importantly, like what is this digital intervention meant for? Is it to monitor them and their habits, or is it supposed to provide them with the education component to them understanding their disease, getting them confident, right, to be autonomous with their self-management? And this is, again, part of the entire formula of figuring out how to manage their disease. And this kind of conversation is definitely something to have with your family healthcare team.
In our final clip, Dr. Mark Stellinger, pediatric emergency physician and author, shares what inspired him to write The Medicine Stars, a novel that blends fantasy, mythology, and medical insight. He explains how the book helps educate children with asthma and other illnesses in an engaging, empowering way.
So I'd like to move on now to The Medicine Stars, which is your book. It blends fantasy, mythology, and medical insight. What inspired you to take this approach to educate children about asthma and other illnesses?
I'll keep it short, but the origin of this book goes back before the pandemic, the coronavirus pandemic. I had a good friend at Children's named Tim Kehoe, and he was an author himself and an inventor. And he only worked at Children's in the marketing department because he was essentially an entrepreneur, and maybe a little different in Canada than the States, but he needed health insurance, right? So he had to work at Children's in the marketing department to provide that because he had 5 children at home. And someone came up to him and said, "Hey, listen, I think you and Tim would kind of hit it off." And somehow, through whatever connections, we ended up on a similar committee together through the hospital. And true to word, we did hit it off. And next thing you know, we were kind of having coffee here and there. In between, we had a free moment. We'd meet up, and he was so encouraging. He said, "But boy, Mark, you have so many ideas. You have so many like creative outlets. Like you should write. You need to write. Like please just start putting pen to paper, so to speak." And I said, "Well, I have 2 kids. I this, I that. I don't know what to write." He said, "No, find your niche. Believe me, you'll find it. You just look a little harder and you'll find it. And in fact, I'll show it to my agent if you write something." He's so encouraging, so positive, and so kind. And I said, "Okay, well, we'll see. And then we wouldn't see each other for a month or 2 or 3 because of work and life and things. And then I went to that same committee, and I was driving to the hospital, and I said, "Oh, I'm going to see Tim today. Great. Maybe we'll get a cup of coffee after and kind of see what he's up to, what he's inventing these days, things like that." And I went to the meeting, and someone walked by me and kind of put their hand on my shoulder and said, "Hey, man, sorry about Tim." I was like, "Oh." I'm like, "Oh man, he's not gonna be here today. Darn, it would have been a much better meeting if he was here." We just goof off a bit, but then someone came to me, and whenever somebody does the arm around the shoulder maneuver, "Hey, let's take a walk," that's a problem. So we started walking and said, "Hey, listen, I want to let you know that there was an accident and Tim died," and it kind of really just, here's a guy could finally kind of geek out about this stuff as an adult appropriately, about writing or about inventing, about toys, about things like that we could just have fun with, and that he was very much involved in. And then just like that, he was, from a selfish level, obviously his family comes first, but from a selfish level, he's kind of just taken away. And short time after, I sat down in front of the computer and I said, "Okay, I made him a promise that I'm going to write, and I'm going to do that." And I sat down and I said, "Now I need to kind of come up with my angle and my niche, and how am I going to go about this?" And he had always encouraged me to use my strengths, like in my knowledge of the ER, in that process. So that's kind of what kicked the ball off at that time. And then during the midst of the pandemic, obviously, a lot, as you know, and those who lived it know, the world was upside down and people were losing jobs, and there's really no time to write a book right now, especially as an ER doctor dealing with the things I was dealing with. So I put it down. And then I went to work one day, and I met this young lady who was there for a different reason, but pretty ill. But she knew she was going to be in the hospital, so she brought her mom was wise enough to bring a little tackle box full of charms and things, of hearts and stars and moons and things like that, so she could maybe do a craft while she was getting cared for, once she was feeling a little better. And in talking to trying to get down to a patient's level, which is I feel is a massive part of all this, I walked in the room and I wanted to listen to her chest, and I said, "Oh, the doctor's favorite symbol is stars." So the original name of this book was "The Stars in Our Sky," and she said, "Oh, that's cool. And she had little things, So I left and I came back a little while later. She asked what she was doing. And before I even had a chance to show you how resilient children, how beautiful they are, before I even had a chance to say, how are you doing? She held up this bracelet and said, I made these for you. And I thought, that is just out of this world. So I have never taken them off since. And I've had a change in the band if it was old. I went home that night. It was like 1 a.m. And as I often do, I pop my headphones on and kind of let the day go. And I sit down and look at some emails. And I looked at that folder on the computer and said, do I click on that story again that I kind of put aside now for some time? And I did, but oddly enough, it was a whole different version. And I just started writing anew. And come 5 a.m, I had about 70 pages written. I said, I better go to bed. I have to work tomorrow. But then it went from there, and it just felt to buy it. And it wasn't such an esoteric illness where, most wouldn't understand. You're reading this adventure story, and you're also trying to learn something about asthma. Your brain it has to be kind of, you can't let it scatter too much. So I wanted to kind of start with that one and kind of unveil this way of teaching.
And with the conclusion of our final clip comes the conclusion of Season 1 of Beyond the Wheeze. To every guest who shared their story, whether it came from lived experience, clinical expertise, advocacy, or innovation, thank you. And to every listener who tuned in, shared an episode, or joined the conversation, your support has made the season what it is. Season 2 launches on October 28th, and there's a lot to look forward to. Until then, you can revisit past episodes, read the recap logs, or learn more at beyondthewheeze.ca. If you've enjoyed Season 1, take a moment to like, follow, and share the show, and consider leaving a review. It helps others find these stories and join the conversation as well. Until next time, keep pushing forward, keep breathing deep, and never let anything hold you back.
Thank you for listening to Beyond the Wheeze. If you enjoyed this episode, don't forget to subscribe and share. Follow us on Instagram at Beyond the Wheeze, or follow me at the Asthma Runner for more updates. Keep breathing strong, and remember, your potential has no limits. Until next time.